A new international study on how the COVID-19 pandemic affected mental health has offered some surprising findings. It said that most of us came through the worst of the pandemic in pretty good shape. With us now to unpack and assess those findings, the two authors of that report. In Montreal, Quebec, Brett Toombs, professor in the Faculty of Medicine at McGill University and former chair of the Canadian Task Force on Preventive Healthcare. In Hamilton, Ontario, Danielle Rice, professor in psychiatry and behavioral neurosciences at McMaster University and a psychologist at St. Joseph's Healthcare Hamilton. And also with us for his read on their report, Quam McKenzie, CEO of the Wellesley Institute and a professor of psychiatry at the University of Toronto. And Quam, it's great to have you here in the studio after being in Points Beyond for so long. And we're glad to have our guests, the authors of this report, in Montreal and in Hamilton, respectively. Let's just start off here with a description of your study from the Globe and Mail from this past week. And here's what they published. The big picture theme of the pandemic, according to a growing collection of data, is not panic, but resilience. As a new international study led by Canadian researchers and published Wednesday in the British Medical Journal suggests, humanity has, for the most part, quote, made the best of a difficult situation. The meta-analysis looked at 137 international studies from 31 countries that followed the same people both before the pandemic started and after the lockdowns began, and found no significant declines in mental health. Okay, let's get into this. Danielle, was this the result you were expecting?
No, this was not the result that we were expecting. Certainly with changes in people's lifestyles, having to work at different places, childcare has changed, financial situations are different. On top of the whole health aspect of the pandemic, it would have certainly been reasonable to think there may be some somewhat bigger of a mental health impact than we did find in the paper. So yes, this was a nice finding, but certainly some surprise.
Brett, when you saw the findings, did you sort of say to each other, we got to go back and look at this again. This can't be right.
No, we're good at what we do. And we went through and we vetted this very carefully. I think when I saw the headlines, I wish I would have put it differently. You know, I think if you read our paper carefully, you know, we didn't say that had, you know, little to no effect. And I think that's an important thing. I think what our paper shows is that this was a much more nuanced situation than what had been trumpeted by many academics in the media, that, you know, it was messy. The pandemic means different things for many different people. I think one of the main findings from our study is that, you know, it wasn't a tsunami or a catastrophe across the population, which is really consistent with what we see in other disasters and other But there were some indications that were some trouble spots for different people, and there were some real gaps where this should be a wake-up call where we're not collecting the data that we need. So I think my biggest take back was saying when people started putting out headlines that said no difference, no significant difference was the word there, and I think that's something we need to be really careful about.
Well, you're not going to be shocked to hear that media don't always get the nuances right, so let's see if we can do a little better during the course of our conversation here. Danielle, okay, so not the catastrophe you anticipated, but the word messy was used. Just put a little more flesh on that bone. What do you mean messy?
Sure. Well, I mean, with Brett using that word, I don't want to take it out of his context, but part of this is that we had data that we're trying to pull together from different countries. There are gaps, as Brett said, and there are also some limitations in the quality of these different studies. It's also messy in the sense that some people did worse, some people did better, some people stayed overall the same. So it isn't this consistent finding of everyone having one experience. So it becomes a bit of, as Brett described, I'll say a mixed bag of differences between individuals.
Okay, Quam McKenzie, let's get you in here now. This is not quite the story that we anticipated being able to tell after, even with the messiness, et cetera. The notion that there wasn't a catastrophe of mental health out there among all members of the population, I presume is some good news. Are we more resilient than perhaps we gave ourselves credit for? That's the question.
Well, I needed to start off by thanking Brett and Danielle for the study. Fabulous study, loads of people on the study, loads of data, very, very difficult to do, but also very difficult to interpret because, as they say, it's complex and it's very messy. And we don't want to be in a position of being a meteorologist saying it's not raining when people are coming in wet, right? It puts us into disrepute.
So it's raining on some people.
And so when you're in a situation in Ontario where we've got 50% more people wanting psychotherapy, when we're in Canada where we've got a 300% increase in the number of people going to the Kids Help Phone, when we've had the substance use crisis with the overdose deaths, and when we're seeing in emergency departments huge increases in the number of people coming with mental health problems, we have to be very careful not to give the impression that we are saying, actually, no, there's nothing wrong, because the statistics, I know they're not.
They're not saying that.
Oh, no, I know they're not. I was really glad to hear that. That the statistics say that you're not suffering. So have we got a mental health crisis at the moment? Sure. Worldwide, are there people who've done well and people who've done badly? Most definitely.
Well, let's break that down then. Brett, can you tell us good news that perhaps many of us have been more resilient than we anticipated, but can you break it down demographically? Who tended to have a harder time during the pandemic? Who tended to be more resilient during the pandemic?
I think for the most part, we had glimpses here and there that show that, again, I think, again, like I said, if we're going to draw a strong conclusion with lots of confidence, there wasn't a tsunami. There was not a massive hit to the population, and no group found that. I think, given the messiness of the data, if we wanted to say in any particular group, was there minimum change to little change, small, that being by that precise becomes very difficult. I don't think anybody should trust the data that are out there to do that. That said, we went out. It's interesting because when people talk about studies, they say things like, well, they didn't examine. Well, we went through 95,000 articles. Our team did a wonderful job, and we examined every single study that published data on any group, and we specifically looked for data in a lot of groups. People in poverty, racialized groups, women by sex and gender minorities, and we didn't find there were no data that could be put together on particular people in poverty, racialized groups. The group that we did find that did consistently across our outcomes, we looked at anxiety symptoms, depression symptoms, and general mental health, which is a combination of the two, is that women and females did worse across the board. Overall, it's a small amount on any given person. If a given person changes by a small amount, some people are more sensitive, would notice it, others might not. But when you find that on a group of people like that, that tells you that there are definitely more people in that group who are getting worse than that aren't getting worse, and we need to pay attention to it. We did not study why people may have or may not have gotten worse, but I think it's pretty well documented in that group that women were facing a lot of challenges, more on average than others. They were more likely to be heads of single-family homes, living with less income, more likely to working in sectors that had tremendous challenges in elder care and healthcare. And it is well documented that intimate partner or domestic violence went up, and that's not entirely directed at women, but largely so. So there's a number of reasons why that's consistent and a reason for concern.
Okay, let me jump in here then, if I can. I want to get Danielle then. The gender issue, sex and gender issue is interesting. Let's talk about income levels as well. The assumption is that if you were better off financially, you rode through the pandemic more easily than those who were worse off financially. Did your data confirm that?
That wasn't a population that we had enough data to be able to get that subgroup level in terms of the income. But so as you say, it's a reasonable thing to consider. There are more resources among those who have a higher income. It's also more common that they're able to work from home in many of these instances. Whereas, as Brett said, with many of the females and women, for example, they're going to work every day trying to figure out their N95 mask fitting while also trying to do childcare at the same time. So we more have the data to be able to speak to the women and females.
How about in terms of senior citizens? They certainly disproportionately died more because of COVID-19 than the rest of the population. What about their mental health?
Yeah, that's what happened, especially in Canada with long-term care situation was horrific to read about. And I know many people lost loved ones in those situations. Again, this is an area that we actually didn't see a huge change in terms of mental health, but we are so limited by those vulnerable groups. We're missing a lot of the data. So it's an area that I think would be really important that we get more information on. And we are limited in terms of what we can say for those groups, but that wasn't one area that we saw a big change in terms of depressive symptoms, anxiety, and general mental health.
Quam, what about your experience in that group? If you're 75 plus, what did the pandemic do to your mental health?
Interestingly, some of the studies out there that are not as robust as this study have looked at seniors' mental health, and they actually showed that during the pandemic, it was actually younger people who had the biggest impacts on their mental health than older people.
Is that because they didn't have as much experience dealing with tough times than older people?
I don't know. I haven't seen the results of any study that's really looked at that. But yes, I mean, there's a certain resilience that comes with age that you and I both know. But I think that one of the issues about this study, which the authors clearly have indicated, is that some of the big risk groups, like people in poverty, racialized populations, they're people who weren't in this study, or there weren't particular studies about them. And they're the people who you'd have expected to see the biggest impacts on. And so we have to be, as they say, nuanced and limited in what we say with regards to policy, especially since out of those 137 studies, only 5 of them had Canadian data.
Brett, as thorough and as professionally as you believe you have done your job here, have you still received some blowback, I guess, from people who may have read the headlines and, jumped to conclusions that perhaps they ought not to have jumped to, but that's the way the world works some days?
There's interesting. There's a few different categories we hear from. There's a lot of people out there who haven't read the study and are saying a lot of things, and which is unfortunate. We've gotten a lot of comments from people who, good epidemiologists, stuff, who've been very complimentary of this. And I think some people in mental health are concerned about this, and what we found. And I think that, one thing we worry about is, I think the mental health field should really reflect on how they've looked at this, because, when this started, people were making pronouncements with quite a bit of certainty about what was happening in the population on the news and messaging as experts. They talked about even suicides, and they said suicides are going up factually in Canada. We had these out there. They're going up. They're telling us how much. And suicides didn't go up. Suicides were stable or went down in some jurisdictions. And I think it's, there's, if it's out there, what we see here is we've got some slivers of dark coming out. And we need to shine light on those slivers of dark and find out a way to bring light to those people there. But in our field, it's not been completely dark. There's another side of the story that we do have communities that are resilient. People have, the other side of the coin is that people have done wonderful things. They support each other. Dr. McKenzie is talking about older people, and some of the older people we work with have learned to use technology. They're seeing their families more often. They've cooked for each other. So they're communities that are rising up together. They're taking care of each other. And I think we've disenfranchised them a lot by talking about them as we are. And when our experts in mental health went out and said, you are not coping, you're falling apart without data to show that, you're committing suicide when they're not, I'm not sure why in our field we insist that there's darkness everywhere, when there are pieces of darkness and pieces of light, and we need to bring light as more as possible. But I think it's there needs to be reflection on why we're messaging like that, and if that's the best way to help people who are out there fighting to cope and persevere, with us telling them that they're not doing it when it's either inconsistent with most of the evidence or without evidence to say that.
Let me follow up with Danielle on that, because that's a fascinating point. Do you think media perhaps contributed to whatever difficulties in mental health some people suffered by constantly harping on the fact that everything was terrible over the last 3 years?
Certainly, I think that can have an impact. I mean, we know in general that negative thinking styles are not overly helpful. So if you're being flooded or seeking out the information that is negatively focused, that isn't something that's necessarily going to help mental health. I mean, a pretty core unhelpful thinking style is jumping to conclusions and fortune telling. And I think we saw some of that, as Brett mentioned, without actual data to back it up. And that would certainly be reasonable to think that could contribute to people's, at least their perspective. Whether that's a diagnostic level of anxiety or depression is a different story, but certainly that could impact their mood and their perspective and thoughts looking forward.
Can I get you on that, Quam?
Yeah, I agree that people tend to look at what went wrong rather than what went right. And there is some data out there looking on the StatsCan website, not looking at the individual level, but what happened in communities after the SERB. And the SERB improved people's mental health.
This is the emergency
This
response
is the
benefit.
emergency response benefit. And financial insecurity is linked to poorer mental health, anxiety, and depression. And you would imagine that if you give people an income supplement, that would help. And I think that sometimes when we're thinking about resilience, we tend to think about resilience at an individual level. But actually, this study is about country resilience. It's about what happened, what were the inputs to the population to allow them to do better. And I do think there were some positive things that happened. I agree with Danielle, there were some negative things where there was some negative messaging about, oh, it's a catastrophe, it's terrible, it's awful, you must all feel really bad about this. And not trying to be too British stiff upper lip about this, but still, there is a midway where you are trying to build people's resilience and build people's fortitude while producing programs to support them, like the SERB and other programs that will help their mental health.
Let me get Danielle on that. I know we live in a world nowadays where nobody wants to give the federal Liberal government any credit for anything at all and blame everything, including bad weather, on them. But on this, do you think they're entitled to a little bit of credit for the fact that they created the SERB and got it out in pretty swift order, worrying not too much about fraud and worrying more about making sure people were protected during a once-in-a-century pandemic? I don't know. What's your view?
Certainly. Universal basic income is, as I mentioned, it's something that can help people's mental health. If people can't eat, it certainly makes them, if they can't get food, if they don't have housing, it's going to make it much more challenging to start learning these other coping skills. So I think that deserves some credit. And I'm actually going to piggyback and say there are some other resources and things that were put in place that deserve some credit. Wellness Together Canada was the first freely accessible mental health resource that people can use. I mean, I've called it to tell my patients. It took me 7 minutes to get through to direct counselor. This is unheard of before the pandemic in Canada. So there are things like that where I do think credit should definitely be given. And I'm glad that these policies and these resources were put in place while trying to navigate the pandemic.
Okay. Brett, as again, solid and as professionally done as this study was, are there some limitations to what you can actually conclude, even as thorough as the study was?
Yeah, and I should clarify, by the way, I think I said we're good at what we do. What I meant before is that, we went back and checked, our procedures have about 6 levels of check in them anyway. So we've been, have been through this many times. Sure, there are definitely limitations. We're scientists who bring together all the data that are out there in the world. And we can only do as much as is there. So, as we talked about, this is, you don't want to get into ecological fallacies where we say this group on overall didn't change. That doesn't mean any individual. We know that individuals in all groups did worse. Some did better, like Danielle said. Again, I think we're very, very confident there wasn't a tsunami out there, and there's a signal for us to reflect as mental health professionals how we portray this. But no, on the fine grain level, we need to know more. We're still working on this. The team here has reviewed young people. I'm old enough, Dr. McKenzie, I can also call people young people, by the way, you're referring to. So, but we're going through almost 150,000 articles now. We're building a case. We've got more data coming on this. We're hoping to find more data on vulnerable groups to fill in the gaps. And I think one last gap here, and I'm not sure how to get across. I think there's a lot of confusion between suffering and human experience and mental health. And that's if we can find a way to get that out better, people suffer through this in all sorts of ways. And there's sadness and frustration. And I think we didn't, I wish we would have communicated better. That's different from mental health. People are suffering who are still in contact with their loved ones, still going to their meals, still doing their work and their schoolwork, despite being sad and frustrated and lonely in this. That's not a mental health problem. And I think there's a lot of confusion out there about that. And so if we could communicate that better, going forward, what precisely it is that we're analyzing mental health problems, which are inability to pull through and keep doing those things in the face of those challenges,
right,
would be something to do better.
In our last couple of minutes here, Danielle, maybe you could help us understand which countries did the data show did better than others, and can we conclude why?
I'm actually going to deflect that to Brett. I don't think we were able to find large changes between different countries, but Brett, please be able to fill in any gaps if I'm missing something there.
Sure.
Interestingly enough, there's two questions here. I think no, there's not data where there in countries where data. There are only about 4 or 5 Canadian data sets. Dr. McKenzie said they generally look like everything else. But this brings up another issue of who's collecting data and doing it well. There are only 2 countries, the United Kingdom and the Netherlands, who had large, robust studies at the national level that we could pull forward and say we're pretty confident that they had their thumb on their pulse in their country. And I don't think anyone else can say that, including Canada. We need to think very, very seriously about how we collect data and survey mental health, not just in the general population, in populations we're ignored so far here. And that's something we need to do a lot better, because there just weren't much data out there to answer those kind of questions.
Okay, in which case, Quam, let me give you the last word on this. You're a guy who's spent his life trying to improve the mental health of the people of Ontario, the people of Canada. You now have armed with you a study which may point in a particular direction that you can go to decision makers with. What's your takeaway from this study that you will go to decision makers with?
My biggest takeaway from this study is exactly what Brett finished with, which is that we need really good, robust Canadian data which covers all of our different subpopulations so that we know exactly what's really going on. I'm less confident than Brett that we know exactly what's happened. We don't know, I think, exactly what's happened, and we need better data and better studies here. I'll give you just a very quick example. When we're talking about climate change, we're talking about a very small change in temperature, which then leads to huge catastrophic results. A small change in population mental health can have very significant results for individuals, and we need to really understand what's going on before we start making policy.
Terrific. I want to thank the 3 of you for coming into TVO tonight and helping us understand this better. Brett Toombs in Montreal, Danielle Rice in Hamilton, Quam McKenzie here in our studio in Midtown Toronto. Thanks so much, you 3.
Thank you.
Thank you.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.